All right, let's move on. This story is super, super sad. This one just came out. It happened, it happened this past month, and it's about a woman whose husband was a plastic surgeon, and he was doing surgery on her, and she died from it. And
Like in surgery?
she went into cardiac arrest during surgery and died a few days later. She didn't die in the surgery, but so this happened in
Florida.
Gulf Breeze, Florida. The lady's name was Hillary Brown, 33 years old. Her husband's Dr. Ben Brown, like a pretty well-respected, board-certified plastic surgeon.
They look like a cute couple.
Yeah, I mean, totally normal. Like, yeah, I mean, this is just, it's not
He
like.
did it on purpose. I'm just kidding.
Well, I mean,
Allegations.
I don't know.
It is Florida.
So basically, the woman was having surgery after hours at her husband's office, and she went into cardiac arrest. She was transferred to the hospital and later was pronounced brain dead, and they took her off life support like later in the week. And this just happened like a couple weeks ago. So they're under this thing's under investigation, and I don't think it's under investigation because they think that that anything like purposefully happened. I don't believe
he just
that.
like he wasn't following correct procedures.
Yeah, they're checking just to make sure there wasn't negligence. I believe.
Yeah.
Now, I don't know that. I mean, I looked through multiple news articles because this is all over the news, and so I looked at a bunch of articles about it, and it didn't seem like that they were concerned that he did something purposefully.
Yeah.
Right. But I did want to talk about it because there are, and as I always say when we talk about these sad things, like we're not sensationalizing this lady's death at all, but there are some things that can be learned from it to potentially protect, other people.
I already know one.
Huh?
I already know one.
You probably do. So the little bit of detail. So I got this from all the news articles. She was having multiple procedures.
Yeah, that's not good.
One of them was a fat transfer. So I would assume it was a Brazilian butt lift. It didn't say that, but that would be the obvious one. The patient had multiple seizures in the OR before she went into cardiac arrest. In the 911 transcript, it was stated that the doctor possibly over-medicated the patient. Okay. The doctor stated that he used a different medication due to the regular medication being unavailable. So all of that to me points that they were doing surgery under local anesthesia. Now, that was not stated anywhere, but all of those things kind of fall in line because local anesthesia toxicity, the most common thing is central nervous system problems, of one of which is seizures. I mean, that's kind of the classic, serious complication from getting too much local anesthesia is you have a seizure. Also, when they were talking about the medications not being available, so we do like really, really minor stuff in my office where we use lidocaine, and we can't get lidocaine right now. Like there's a national back order. So that also kind of makes sense when he mentioned, the medication we normally get, we couldn't get because I know that there's a national back order on certain local anesthetics. So I want to kind of just talk about a couple points about this case because at the end of the day, a lady, lost her life in something that should be overall extremely safe. And so, is there something, and not to say that, they did something, wrong, but is there something to be learned from this? So I want to talk a little bit about local anesthetic toxicity. So local anesthetics, lidocaine, Marcaine, Novocaine. I mean, you've always have all had that at some point in your life, right?
Dentist.
Yeah. They stick a needle, they inject you, it goes numb, right? Yeah. And so we've talked about people doing big surgeries under local in the past, which I'm not a huge fan of, and I'll talk about that in a minute. But how does local anesthetic toxicity happen? Well, there's two obvious ways. One, you can accidentally inject that local anesthetic into a blood vessel.
Okay.
So instead of injecting it into the tissues to make them numb, you actually need to go into a blood vessel and you inject it into the bloodstream. And just like every other medication, if you inject something into your bloodstream versus another route, like the bloodstream is the most potent.
Yeah, your body just like
right,
absorbs
instantly,
all of it.
instantly it hits you. The other way is they could have accidentally just overdosed her. When they talk about, we didn't have like the normal medication, it's possible, like we tend to use 1% lidocaine, but they have a 2% lidocaine. So it's possible that they got like a different strength of the medication, and perhaps somebody mixed it up and didn't
Yeah.
realize it was a different street.
And honestly, I feel like because it was almost like she was a regular. And you know how like,
It did say that she'd had multiple surgeries by him.
yeah, and then obviously the wife of the surgeon. It's almost like she's just like a regular showing up to the bar, you know? And it's just like you don't you don't have to pay like super, you know, pay
I mean, you always
attention to
wonder.
them,
I mean,
you
and
know?
it could be either way, right? It could be that, well, it's the boss's wife. You
So
gotta
they were, like,
really pay
overly
attention, or maybe it's like the boss's wife and
laid
she's
back.
really, you know, familiar with them and they're
Yeah.
joking around. I mean,
Yeah,
who knows?
like I could see that being the issue, like too laid
Yeah.
back, not following all the
Yeah.
checks and balances when it comes to the procedures.
It could be.
With that.
I mean, I don't know. I didn't say anything like that, but the other way that you could potentially overdose with lidocaine is if they're dosing you for lidocaine that has epinephrine, but it didn't have epinephrine, because if it has epinephrine is put into lidocaine because one, it constricts blood vessels and you bleed less, but also it increases the amount of lidocaine you can give, because it's less likely to get out into the bloodstream if you use epinephrine. So say, for example, like they had a stronger concentration and maybe it didn't have epinephrine, then even using an amount they were used to could potentially cause a toxicity. So like, what is there to learn from this? Because at the end of the day, like we don't want to talk, you know, about some lady's death in just a flippant way or just to, you know, for clicks. You know, I really am kind of against people doing major surgery under local anesthesia. And I've done surgery under local. I mean, it's not that I'm not familiar with it or haven't done it. I have, and I just don't like it. I mean, I've done it safely. I've never had anybody, you know, have like any kind of significant complication from it. But having done it myself, I can absolutely see how it could happen. I mean, if you're doing something under local anesthesia, you have to get perfect anesthesia. Like if the patient's like in pain, it then makes it more dangerous because they're moving. It's a moving target, and you could potentially cause an injury just because they're not, you know, being still. So then you're obligated to give these larger amounts of local anesthesia because you have to have the patient be comfortable. And also, she was having multiple procedures, which to me is a little bit of a red flag. And who knows what that means? I mean, maybe she had like something really small and then also this other procedure, and they're saying multiple. But it would be unwise to do multiple large surgeries on somebody using local anesthesia. You're going to bump up against the toxic dose. It's going to happen. I mean, I know this because like I said, I've done some surgeries. I really don't do them anymore just because in this day and age where I'm pretty busy, I can pick and choose what I want to do, and I just don't want to deal with that.
It's like, even though it's like you can do it, but it's like, should you?
Right, exactly right. No, totally.
And like, I feel like whenever you're talking about like the local anesthesia and versus like going to a surgery center and like actually having it, it's almost like it's another, I can do that, but should I?
But should I? Totally.
But then it's like, I feel like the surgery center is just like a safety net. Like we're doing everything possible to make sure that you're safe and that we're doing what we're supposed to do.
And I'm going to talk about that too. And you know, finally, my big issue with surgery under local, outside of just the safety issues, is just the comfort issues. I mean, I did 2 breast augmentations under local many years ago, just really to see if it could be done. And I did them, and they both went fine. One patient sailed through it. I mean, it was so easy, like it was not really that hard. The next patient was like in discomfort. I mean, not like so much that, you know, she was mad about it, but like she had a rougher time doing it. So you get this big variability in how patients can tolerate this.
My augmentation was definitely done at
Yours was done at a local?
I'm pretty sure it was. Like I didn't go to a hospital. I went to like a office building.
But you were awake for it?
I mean, I wasn't awake. No, he put me to like I was asleep.
Oh, then they put you under anesthesia.
Oh, okay. Yeah. But I like went into like an office setting.
Well, you can still do anesthesia in an office.
Okay, cool.
Yeah, totally.
But yeah, no, I wasn't awake. You can do that when you're awake.
Yeah. They were wide awake when I did it. Yeah. That's the whole thing about local anesthesia. Like you're awake, like you're not knocked out. Like that's the whole thing about it.
Okay.
Sarah, bing.
Well, I thought whenever you would say like surgery center, going like in surgery, I don't know why I never thought like they were awake. I thought because I know that we've seen those videos of like being awake.
Now they may have given them like a Valium or something, but like they're not like under like a general anesthesia. Yeah, for all intents and purposes awake. My other kind of concern about this, and you know, this will probably annoy some plastic surgeons. I'm not a huge fan of like surgery in the office. I personally use a surgery center. At one point in my career, I thought about doing like an office OR, and I ended up not doing it. I'm happy I didn't. But as a patient, you have more protection in a surgery center.
Yeah.
There's more oversight. There's more resources. I mean, if this lady had had a seizure in a surgery center, even if they were doing something that are local, they could have intubated her and put her on life support, and she wouldn't have died. I mean, they would also have had the IV lipids, where that's the reversal for local toxicity. They would have had that there most likely. So, you know, the fact that this was done in an office, like it absolutely, you know, has some contribution to the outcome.
Yeah.
And so, you know, I mean, and there are plenty of great surgeons who do surgery in their office and they do it safely, but it's just one more potential way that something could go wrong.
Yeah.
And we've talked about different news articles where like a doctor did something in their office OR, and like the guy who didn't call 911, like that would never happen like in a surgery center.
No.
Because there's too much oversight. So there are two things about this one: multiple procedures. I mean, they didn't really say what multiple procedures were, but you know, I'm not a huge fan of like doing too much surgery at once. I mean, it just opens you up to risk. It may have contributed to this if they were doing multiple procedures with local. I mean, that absolutely could have contributed. And then finally, you know how I feel about BBLs. Like,
Yeah.
I don't think that BBL was, her symptoms don't sound like a fat embolism, which is the one that whenever we talk about BBL deaths, is.
I'm just like trying to figure out why would somebody want to be awake doing that?
I don't know. I mean, I just don't know. Like, if my wife,
Unless,
even if,
like, I guess there's some people that are scared to be put to sleep.
it's so much safer. Even if like I was doing local anesthesia surgery, I wouldn't do it on my wife. There's no way I would do that. You know?
How like nerve-wracking too. It's like when your wife is like watching you cook or something.
What, to do surgery on them?
Yeah.
I mean, I've operated on all of my family members. I mean, they say you really shouldn't do like life or death operations on a family member, which I kind of totally agree with. Obviously, what I do is not really life and death these days, but yeah. I mean, I feel bad for everyone. I feel bad for the guy. I mean, because, you know, I mean, he's got to live with that the rest of his life, which
I wonder if he'll continue his business.
I don't know.
I did think about that though when you
What's
first
that?
like brought up the story. Like, is it probably like frowned upon for him to like be doing that like on his life? Just because if something happens, you kind of go into a more emotional state than a critical thinking state.
So I've operated on all my family members, and maybe a lot of it's because I'm kind of grandfathered in, where like I started in a time when it was still not that big of a deal to do it. Like some hospitals won't allow you to do certain surgeries on a family member because if they were to have a complication, they feel like you wouldn't be able to think clearly.
Right.
Which, I mean, I kind of get that. I mean, but once again, I don't do life and death surgery anymore. So, you know, I mean, I literally operate on my wife, both my kids, my mom, my brother. I mean,
would you be able to operate on me, Dr. Herman? And if something started to go wrong, you would be able to critically think, or you would emotionally think? Okay, all right, for sure.
Yeah.
I trust you. I trust you.
Dude. What are you looking for, man? Are you in the market?
I want like 2 more dimples, like above the ones I currently.
Are you sure you don't want elf ears?
Yeah, I'll take that too.
I thought you were about to say something serious. I was like, what's happening? What do you want?
No.
So, well, anyway, so it's a super sad story. Our condolences to her and her family and all of that. It's really sad. I'm gonna kind of keep an eye on that.
Very
See,
scary.
I don't think anything's gonna come up that's gonna be shocking. I think it's gonna come out that it was a lot,
An accident.
an accident, and then that's the end of it. But yeah, it's really, really sad. So.